Hi, well, we have another new concept, and that's what I'm calling clinical update. So, what is happening now is this exponential increase in clinical research on herbs. And it's really difficult to keep in touch with it all. And some of the information that's coming through can be really valuable for us in our clinical practices. So, what I'm doing now, and will do so periodically in the future, is give you an update on specific herbs and refer to the most interesting and novel and indeed informative developments in the clinical research. And what better to start with than the wonderful herb Andrographis paniculata. So we're going to look at trials that covered 5 clinical topics: immunity, COVID-19 infection, diabetes, osteoarthritis, and multiple sclerosis. Now, we all use Andrographis for immunity, and I'm sure some of you might have been using it for COVID infection. But you might be surprised to learn that there's clinical evidence that Andrographis can help diabetes, osteoarthritis, and even some aspects of multiple sclerosis. So let's now look at immune activity. And despite the fact that we have an understanding of Andrographis as an immune herb, to date, there's not been very much clinical evidence to back that up until now. This study that was published a couple of years ago in 2021. It was an open label, single-centered study in just 30 people. And they took Andrographis, a standardized extract of Andrographis, 200 milligrams a day, and it was standardized to 30% andrographolide, so 60 milligrams a day of andrographolide. And they looked at people who had lymphocyte counts in the range 1 to 4,000 cells per cubic millimeter, which is more or less normal. What they found was that this standardized extract of Andrographis increased T cell counts of certain fractions. And again, fractions of helper T cells were increased. And it also significantly increased by day 30 2 key cytokines involved in immune response: interferon gamma and interleukin 4. And also interleukin 2 was, in fact, decreased by day 30 when compared to baseline. So we now have clinical evidence that Andrographis, as an extract standardized to andrographolide, does have immunomodulatory effects that are expressed, for example, on both immune cell fractions and levels of cytokines, and it was safe and well tolerated. But let's now look at some of the details of the findings. So this was done in a smaller subset out of the 30, 21, who had lymphocytes ranging between 1 and 3,000 cells per cubic millimeter. And in particular, look at the CD3 cell count. So by day 0 and day 3, it wasn't much changed. If you go along that line, you see the p-value 0.86, so that's not significant. Sorry, day 0 is your baseline, so day 3 was what was not significant. But then by day 7, it's beginning to come up, and it is significant. And then by day 30, it's 2024.4 plus or minus, and that is hugely clinical significant. Also, if you go to the line above, look at the absolute lymphocyte count range. So it does go up, and it goes up quite substantially by day 30. Now, we often do see patients with low lymphocytes, and here we have clinical evidence, at least in healthy people, that Andrographis can boost lymphocyte count. The other thing I want to point out is the interferon gamma. So you see the p-value by after day 3.92, no significant change. In fact, it even dropped a bit. And similarly, after day 7, no significant change. But have a look at the massive increase that occurs by day 30, which is hugely statistically significant. So that 20.8 number picograms per mil for interferon gamma. So that is quite an interesting result, because interferon gamma, of course, is involved in our capacity, especially to combat viral infections. So what these results do, by especially showing these significant effects at day 30, is they perhaps call into question the clinical way many of us using Andrographis, and myself in particular. I'm using it short term during acute infections, but this suggests, as I have maintained that the HERV echinacea route does, it has a cumulative effect over time, and you're getting much better immunological protection with consistent use, for example, in this case, 30 days. So that's quite significant. Now, we know Andrographis can have some rare side effects. It can cause an allergic reaction, and even rarer, it can cause altered taste. So watch out for those if you're giving Andrographis long-term. But this is a hugely exciting discovery. I think it probably needs to be replicated before it totally turns the way we use Andrographis on its head. But it's something I will certainly be exploring with my patients, especially when other approaches are not working for them. So let's now have a look at COVID-19. Now, interestingly, the Thai government made Andrographis one of its official treatments for COVID-19. The papers coming out of Thailand weren't hugely, positive about its benefits, but this clinical trial conducted in India most certainly was. And I might add that a lot of the papers coming out of Thailand were observational about the use. They weren't randomized controlled trials. So if we look at this trial in Andrographis in people with acute COVID-19 infection, there was overall an excellent safety profile. The severity of the disease and its progression were both reduced, suggesting it's a significantly valuable in managing acute COVID infection. And many of the results were highly clinically significant, and there was also a reduction in inflammation. So they used this this extract that was called CIM-MEG19, 400 milligrams a day, and it was used as an add-on therapy to standard care, with or without antiviral drugs, depending on the clinical symptoms of the patients. Now, its standardization was complex, so I can't necessarily give you an andrographilide level that corresponded to that, but I'm sure these results would translate into other Andrographis extracts. And then we have a trial from Alexander Panosian and the Swedish Herbal Institute. Now, they have a combination called Kangjang, which is Andrographis and Eleutherococcus, or sometimes now still called Siberian ginseng, in combination. And the dose of the formulation was 6 tablets a day for 2 weeks of this combination of Andrographis and Eleutherococcus. And from the Andrographis side, that corresponded to 90 milligrams of andrographilides. And the authors said that their study provides new evidence of the efficacy and safety of this Kangjang combination in the acute phase of mild COVID-19. And the results were outstanding. It reduced the risk of progression of the disease, reduced the duration, improved virus clearance, reduced days of hospitalization, and accelerated recovery from a range of symptoms like sore throat, muscle pain, runny nose, and normalization of body temperature. And I think this is important because we're now, of course, facing this second pandemic, if you like, of long COVID. And to me, it's very clear, and there actually have been suggestive studies for all the antiviral drugs, but to me, it's pretty clear that the better you manage the acute infection, the lower the risk of developing long COVID. And hence, I think Andrographis has a significantly valuable role to play. Let's move on now and discuss anti-diabetic effects for Andrographis. Now, in my presentation from a couple of months ago, when I was talking about these new exciting weight loss drugs that are, being very publicized on social media and so on, I mentioned how Andrographis, because it's bitter, increases GLP-1, glucagon-like peptide 1, which is what these drugs mimic. And that suggests a role of Andrographis in both diabetes and weight loss. So I'm just revisiting this trial again for you. And it investigated the effect of an Andrographis extract. And even though it's a bitter effect, we have bitter receptors in our digestive tract, so it was taken as capsules. It wasn't standardized to a very high level of andrographilide, so it makes you wonder what the more potent extracts might do. And it was on healthy and pre-diabetic people over 14 days, 73 people. It significantly increased GLP-1 by 19.6% in the pre-diabetic patients compared to placebo. All other changes were not significant. But this increase of GLP-1, which is a genuine increase, it's not inhibiting DPP-4, which breaks down GLP-1. So the increase in GLP-1 is due to increased production, not reduced breakdown, means that Andrographis, in fact, has anti-diabetic and weight loss potential. And since this discovery about GLP-1 and the use of GLP-1 analogs as weight loss drugs, I've been giving patients bitter herbs like Andrographis, feverfew, wormwood, gentian to help them with weight loss. And I'm quite surprised by the results. It's not dramatic like the drugs, but 1 or 2 kilos a month, that happens consistently over months. So it has opened up a new realm for us, if you like, of the value of bitter herbs. So this is suggestive that Andrographis will have anti-diabetic effects, type 2 diabetes. Is there evidence for that? Well, yes, this is not a recent trial, and it's small. It was only in 20 type 2 diabetes patients. There are other trials, but I picked this one out, and it was taken over 12 weeks. And it was just a powdered herb, just to show you, 1.8 grams a day. And again, you're probably going to get much better results with a high andrographilide extract. So significant decreases in HbA1c, glycated hemoglobin, and fasting serum insulin drop by 20% were observed. And also there was a decrease in fasting blood glucose as well. So while some parameters did not change, the results indicated the anti-diabetic potential of Andrographis. And if we look at the results, fasting blood glucose, HbA1c, and fasting insulin, there they are presented in table form. Now, the only thing about the fasting blood glucose is the P was greater than 0.05, so it wasn't statistically significant, but it did reduce. And I believe if you use a more potent extract of Andrographis with higher andrographilides, you will see that reduction in fasting blood glucose. It may surprise you to learn that Andrographis has anti-inflammatory activity. Certainly, the COVID clinical trial that I mentioned before, it did exert anti-inflammatory activity as part of its benefits. But what about something like knee osteoarthritis? Well, it does appear to be effective. So in this trial, 103 people with osteoarthritis of the knee were given one of three things, either Andrographis extract at 300 milligrams a day or at 600 milligrams a day. And it's quite high in andrographolide. Look at that. So massive amounts of andrographolide from the high dose, 300 milligrams, 600 milligrams of a 50% extract, or they were given a placebo and followed for 12 weeks. And those patients who received either dose of Andrographis demonstrated a significant reduction in pain at several time points compared to the placebo group. Quality of life, as per the SF short form questionnaire, and functional assessment of chronic illness therapy, all those scores also improved. The WOMAC score also improved. I'll show you in the next slide. So Andrographis extract, and particularly it's probably better to use the lower doses I'll show you, was found to be beneficial in reducing pain associated with mild to moderate osteoarthritis of the knee. And the lower dose was as effective as the higher, as I will show you, and improved quality of life and reduced fatigue. So there you see Paractin is the Andrographis extract, and you see results for the 300 milligrams and results for the 600 milligrams, and then followed over time. And you see that the placebo pain didn't alter over time. For the 300 milligrams a day, pain went down, almost halved over time, highly significant. 600 milligrams a day, similar result, not quite as good as the 300. Stiffness, also down, highly significant, again, roughly halved. And again, the 300 milligram dose worked better. Physical function score, down about a third. Again, the lower dose worked better. And then the WOMAC score, which is an arthritis score, it went down tremendously, and especially, again, at the lower dose from 71.66 down to 48.26. Again, highly significant. So we have another treatment. Admittedly, you probably have to give fairly high doses, because even that low dose of 300 milligrams a day had 150 milligrams of andrographolide. But nonetheless, we have another herbal treatment for osteoarthritis, and one that will benefit, of course, their immunity as well and their blood sugar levels. And great, how good is that? But do watch out if you're giving it consistently long-term, as was done in this trial, for the side effects of allergy and loss of taste. And finally, Andrographis was studied in patients with MS, with multiple sclerosis. Now, the trial results weren't absolutely brilliant in terms of the progression, influencing the progression of the MS. But here's an important point. Andrographis is an immune herb. And if you go back to my very first slides, it has proven impact on immunological parameters. And yet people are still saying, oh, you can't give immune herbs in autoimmune disease. Well, here, Andrographis was given in multiple sclerosis with benefit. And to me, that is proof of principle that you can give immune herbs and they are beneficial in autoimmune disease, and especially my favorite, echinacea root. And it's quite ironic when you go onto MS websites, and for example, they particularly caution MS patients about taking echinacea because, it'll make it worse because it stirs up your immune system. It's a load of nonsense. So this was a double-blind, randomized controlled trial, DBRCT, small, and 25 people over 12 months. And again, quite a high dose, 340 milligrams of extract that was 50% andrographolide. I don't use those sort of doses, by the way. So, if it's going to make the MS worse, that dose certainly would. And they looked at the outcomes. Now, that they've found a benefit for fatigue, so that's why it's kind of emphasized by the authors, because they like to trumpet their positive results. But it was on patients with relapsing, remitting MS who were also receiving interferon. And there was a significant 44% reduction in this fatigue severity scores compared to the control group that was only taking the interferon. However, there weren't any statistically significant differences observed for the course of the disease, like the relapse rate and inflammatory parameters. But there was a trend to reduce new brain lesions or CNS lesions among the Andrographis group. So certainly no harm, potential benefit on the disease in terms of reduced new lesions, and certainly quality of life benefits on the patients in terms of reduced fatigue. So Andrographis extract was safe in patients with relapsing remitting MS and effectively reduced fatigue without significantly changing other clinical parameters. So thank you. I hope you enjoyed this brief clinical update on one of our very important herbs, Andrographis paniculata.